A medical procedure is giving those suffering from spinal fractures caused by osteoporosis a new lease on life.
The quick surgery provides almost instant relief. Channel 8 Eyewitness News reporter Nicole Cousins has this special report.
Esther Weinhold walks through the halls of Brian East's radiology department. She's 83 years old. You can hardly tell by the pace she's keeping. Even more surprising, Esther suffered a fall last October.
I was so uncomfortable.
It fractured her spine, leaving her family to wonder if she'd ever take another step.
We didn't know if she could ever walk again. She may have to be confined to the wheelchair for the rest of her life.
Esther is one of about 10 million Americans battling osteoporosis, a debilitating disease that weakens your bones. It's more common than stroke, heart attack, and breast cancer combined. And compression spinal fractures are a frequent side effect.
A compression fracture is very debilitating. It's usually severe pain, and it's worse with movement.
An interventional radiologist at Bryan Medical Center, Dr. Michael Budler's solution to spinal fractures is simple and a little unconventional. He uses balloons and cement to fix them while also realigning the spine. It's called a balloon kyphoplasty, a procedure radiologists have been doing for 20 years, and the results are almost instant.
They may have a little bit of soreness for 3 or 4 days, but that deep, sharp, debilitating bone pain is gone.
It works like this. Radiologists make 2 small incisions along the patient's spine. Using a needle, they insert tiny balloons inside the compressed vertebrae. Those balloons are inflated to about the size of a mini marshmallow, creating an empty cavity. Then the balloons are removed one by one and the holes are filled with bone cement, a procedure that takes all of 20 minutes.
It was a huge difference, and it was almost within an hour after the procedure, which is awesome because then you know it worked.
Well, I've gained quite a lot of strength back, and my back just doesn't bother me.
That lack of pain is a big relief, not just for Esther and her family, but for those doctors also trying to curb the opioid crisis. Patients with spinal fractures are often given the drug to combat their injury, which can lead to addiction. But with a quick procedure like balloon kyphoplasty, reliance on opioids is minimized.
It decreases pain 80 to 90% of the time immediately after the procedure, and that allows patients to decrease their need and get off the opioid pain medications that they're often put on.
As for Esther, she's recovering well, continuing with therapy and rehabilitation to keep up her strength.
Makes you independent, and I'm just glad that I can do it.
That independence leading to many more steps in her life ahead. With this special report, I'm Nicole Cousins with Channel 8 Eyewitness News.